Hi, this is Paramedic Pete, and welcome to my series of Doing First Aid Better. And this is episode 1, and today we're basically going to talk about several different pathways we can follow. You would have already had drilled into you the DRS ABCD pathway, and this is a great pathway for our unconscious or managing our unconscious or our cardiac arrest patients, because it basically runs down what we need to do in that sort of an emergency. But these aren't going to be your typical presentation of patients when you're working as a first aider in your work environment or out in the community. What you're generally going to find is most of your patients are going to be awake, they're going to be breathing normally, and they are going to have some sort of other injury or illness that we need to worry about. So if we use DRS ABCD, we've checked for danger, so there's no danger to ourselves, our patients, bystanders, or our equipment. We've done a response check. Now, the response check, I also call it a resource check because it just makes it a little bit more clear in what we're actually doing. So the response check, yes, we're trying to see whether or not they're awake or not, but in a bigger picture, we're actually looking at what we've got and whether or not we need more resources. Now, if we do need more resources, we can go to S, send for help. So in a cardiac arrest, that's called 000. But in a typical first aid sort of environment, that is call someone to go get the first aid kit or something like that. So several years ago, I developed another pathway or an adjunct pathway to the DRS ABCD, and it's called the PACE pathway. So PACE. So if you're presented with a conscious patient, remember not to rush in. We want to pace ourselves. So why do we need another pathway? And the answer's simple. People like structure, and to get the best patient outcome, we need to provide the first aider a simple path to follow rather than haphazardly jumping backwards and forwards and when they're treating their patient. So the PACE pathway, to put it out there, is P is we want to position our patient comfortably. A is we want to do the assessments, and as we find injuries or illnesses, we fix them. C is a lot of C words, but they all revolve around communication. If you have effective communication with the patient, with bystanders, with emergency services, you're going to get control of the situation, another C word. You're going to gain confidence in yourself. Your patient's going to gain confidence in you, which then they're going to provide you with consent. It's going to keep the situation calm. And then the big one that I like to talk about is that if your patient is confident in your techniques and your treatment, they're going to be compliant. And compliant is that your patient is going to do things when you tell them to do things. So if you need them to hold a pad in place because they're bleeding, so you tell them, I want you to hold that pad in place, don't lift it up. If your patient's compliant, they're going to hold that pad in place. If they don't have confidence in your treatment, they're going to be picking that pad up and having a look at their wound as soon as you turn your back. Or in a, say, the snake bite situation, if you tell them, look, you need to lay as still as you can because you've got a snake bite and we need to stop the venom from going through the lymphatic system because muscle movements creates lymphatic flow. So I need you to stay as still as possible. If they're compliant, they're not going to get up and walk about. Then we get to E, and E's for the initial couple of times that we're going through this cycle is not the end. It's go back and do everything again. Eventually, it's going to become either we're going to extract our patient, another E word, or it is going to be the end of our treatment where we need to advise our patient on further treatments. Say that it's a sprained ankle, you've done your ice treatment, and you basically tell them, okay, if it doesn't get better in 24, 48 hours, I'm going to advise you to go see your doctor. So let's put this PACE pathway into a first aid scenario and how we can use it. So we're in our workplace, in our first aid treatment room, and a patient presents to you, comes through the door, knocks on the door, and they're seeking some first aid treatment. So we start off with our D, danger, And we're already aware of our dangers within our first aid room, but we've got a new one presenting, which is the patient. So when we talk about patient being the danger, we then talk about our PPE that we need to wear, like gloves, masks, gowns, whatever, depending on what's happening with our patient. So this is a patient, it's just knocked on the door, so they're our danger at the moment. Response, they've just walked in, so they're alert. So we know the rest of the DRS ABCD is not going to be effective for this patient, so we're going to jump into the PACE pathway. So P, let's position our patient comfortably. So this is where we can straight away offer them either a seat to sit down or the bed to lay down. We generally do not want to treat a patient while they're standing up. So always offer your patient either a seat or get them into a laying down sort of position. Our assessment, we want to do the assessment, and typically I start with the head to toe, but our patient's primary complaint is that they've got problems breathing. So we start asking our questions. So why have you got problems breathing? And they'll tell you in this scenario is that they've just been bitten by a bee and they're allergic to bees. So this gives me, in our first aid treatment, we've done our assessment. This person's going into an anaphylactic reaction due to a bee sting. Our typical treatment for this is to use the EpiPen. So we want to use the EpiPen straight away. So we use the EpiPen, give it into their leg, and while we're about to do that, we're going to be communicating. We may be also calling out to one of our other workmates to contact the ambulance, because anaphylactic reaction, we're giving the EpiPen, we need to call the ambulance. We also have got to get the consent to be able to give the EpiPen, or we'll get the patient to give the EpiPen to themselves and follow the rest of those C's, trying to keep control and the situation calm. We get to E, let's go back and do everything again. We go back to D. D, danger. We've got a new danger there. We've got a used needle. We've just used an EpiPen, so we need to be able to make sure that we can either dispose of that EpiPen appropriately or make it safe. And the easiest way to make that EpiPen safe is put it back in the hard plastic container that it came in. So then it can be transported to the hospital with our patient. So we put the EpiPen in the D phase again, back into the hard plastic container. We then check to see if our patient's still awake, because our patient may or may not have a varied level of consciousness through our treatment. So we're going to always then see if they're awake. We get back to P, position. So we can ask the simple question, are you still comfortable, or are you comfortable? And if they're not comfortable, we'll fix their position. Go back and do the assessment again. An assessment, and my patient still got problems breathing. So in first aid, in anaphylaxis, there's another medication we can use, and it's Ventolin. And we can give our patient Ventolin in the treatment of anaphylaxis. So this is now the step where we can give the Ventolin following the 4x4 technique. We communicate that again, so we get to see, communicate that back to the ambulance and write it down in our incident report forms. We get to E again, go back, do everything again. Danger, check for a response again. Continually to check to make sure they're still comfortable. We're back to the assessment. It's probably now 5 minutes up since the last time we gave the EpiPen, so it's due for another EpiPen, the second EpiPen. Communicate that, write it down in our incident report. E, go back, do everything again, and we just continually follow that. With every 4 minutes after that, we're going to be giving the Ventolin, ensuring our patient's comfortable, and writing everything down and controlling the situation. So that scenario is actually a relatively complex treatment, just made really easy by following the simple PACE pathway loop. And it can be, any injury or illness can be substituted into the pathway. But why does the pathway work? Or what are we actually doing that makes the PACE pathway work? And the answer to that is we're treating our patient for shock. Shock occurs in pretty much all of our patients, from very, 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 very mild to very, 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 very severe. So our treatment for shock is by positioning our patient correctly and reassuring them. So within the PACE pathway, the P is doing our position for shock, and the C, communicating with our patient, is doing the reassurance. Now, shock doesn't occur by itself. It always occurs because of some other condition. And that's what the A is doing. The A is identifying what is causing our patient to go into shock, and it is then treating that condition so we can minimize the progression of shock within our patient, or hopefully reverse shock within our patient by keeping them warm in that comfortable position and keeping the reassurance going until the ambulance gets there or emergency help gets there. So that kind of wraps up episode 1 of Doing First Aid Better. If you've got any comments or you want any more information, please don't hesitate to send me a message, hit the like button, share this presentation off to your friends. There's going to be multiple more presentations I'm going to make up covering the different topics, just so that as first aiders and as first aid trainers, we can do first aid better. That's it from me, Paramedic Pete. Stay safe.